What's up, HSC 425? My name's Dan. I'm going to be taking you through a couple diseases, the first of which is going to be Peyronie's disease. I'm going to start out by explaining the anatomy of the penis, and we'll get into what it is. So as you can see, I've highlighted two main areas, the corpus cavernosum and the corpus spongiosum, both of which are involved with blood swelling during arousal. The tunica albuginea, which I've outlined here in blue, is a collagen-dense area that surrounds the corpus cavernosum. Now, with Peyronie's disease, what happens is there is a large formation of scar tissue in between the tunica albuginea and the corpus cavernosum. All right, so the scar tissue, it's essentially a buildup of collagen fibers, and it is a connective tissue disorder that occurs in about 10% of the male population. And it worsens with age. So if you experience symptoms, you should go get treatment quickly because it will get worse as you get older. So speaking of symptoms, we have them listed as such. So pain, abnormal curvature, indenting, erectile dysfunction, loss of girth or shortening of the penis, and SIDA, which is a chronic inflammation of the tunica albuginea, which I've outlined above. So treatments for Peyronie's disease, obviously you can go under the knife by a highly skilled urologist. With all surgeries, there's an inherent level of risk and danger involved, so most likely your doctor has to prescribe a collagenase that goes by the name of Xiaflex here in the States. Xiaflex is a derivative of the bacterium Clostridium histolyticum, and it gets directly injected into the penis, so it's likely not to be very comfortable. One such therapy that was thought to be beneficial up until the collagenase was released into the public was penile tactical therapy, or PTT. It's essentially just a pulling of the penis for many hours of the day for many months of the year. Not very comfortable, nor is it very effective. Many doctors don't agree that it even works. But still, people continue to do it. One such side note about Peyronie's disease is that about 30% of the 10% of men who get this experience collagen upbuild in many areas other than their penis, so their hands or their feet. So if you get this disease, blame genetics. Alrighty, so the next thing I'm responsible for discussing here is priapism. If I adjust this, it'll help with the glare. There you go, Priapism. So there's two main types of priapism. There's ischemic priapism and non-ischemic priapism. So ischemia is blood flow to a certain area, or a lack thereof blood flow to a certain area. So no blood flow. Non-ischemic would have some blood flow. So most commonly, it is ischemic priapism. Some certain causes for this priapism are sickle cell anemia. This one is starred because it is the most common form of ischemic priapism, or cause of ischemic priapism, rather. Certain medications are likely to cause it, so antidepressants, blood thinners, or antipsychotic medications are all likely to cause this. Certain treatment options for ischemic priapism, an aspiration of the blood in the area, so essentially a sucking out of the blood in the area, an injection of a cold saline solution into the corpus cavernosum, which wouldn't be very fun, and phenylephrine, which is essentially a vasoconstrictor, so it constricts vasal diameter, and in doing so, it increases blood pressure, so it would help with return blood flow to circulation. The other type is non-ischemic priapism. So this one does have blood flow. One major cause of this type of priapism would be genetic mutation. So a formation of an artery within the penis and the corpus cavernosum would cause unwanted erection at any given time. Another way that this one can be caused is through trauma. So SCI is an abbreviation for spinal cord injury. This would happen immediately in some cases. And so what actually happened was they coined this term death erection, right? When they would hang people, they would cause a traumatic spinal cord injury, and it would lead to paraplegia, which is just a complete loss of motor control and sensory control of the lower half of the body. So death erection and non-ischemic priapism are pretty synonymous. As I said, the treatment options for mutation are pretty much surgery. Everything else is pretty untreatable, so cold packs and pressure, not a whole lot you can do with this one. So one interesting thing that I found about priapisms is that the Greek god Priapus is the Greek fertility god. If you want a good laugh, go Google this guy. He has a great picture in Wikipedia. It's pretty awesome. But yeah, that pretty much sums it up.